Have you been diagnosed with hyperthyroidism recently? Still wondering what is it? You've also heard of the term Graves' disease, and you wonder whether the two are similar. In this new series of thyroid problems in Dr. Says, let me clear your doubt today. Now let's get on to it. First up, the thyroid gland is a butterfly-shaped organ located in your neck, just below the Adam's apple. It produces hormones known as T4 and T3, and these thyroid hormones are essential to regulate the body's metabolism in controlling heart rate, muscles and digestive functions, as well as brain and bone development. Hyperthyroidism essentially means high levels of thyroid hormones in your blood. There are multiple causes of hyperthyroidism, the most common being Graves' disease, but thyroid hormone levels can also be raised due to other reasons such as thyroid cancer, or for example a thyroid nodule that is secreting excessive hormones. So you just need to remember this. Everyone who have Graves' disease will have hyperthyroidism, but not all who have hyperthyroidism will have Graves' disease. Get it? Now, what is Graves' disease? It is an autoimmune disease, which means your body's own antibody is attacking your thyroid gland. In this case specifically, a receptor in the gland known as the thyrotropin receptor. Hence, the antibody is known as thyrotropin receptor antibody, or TRAP antibodies in short. These antibodies in turn will stimulate the thyroid cells to increase uptake of iodine, synthesize and secretes more thyroid hormones. People with Graves' disease will often have a diffuse swelling of the thyroid gland, and this is medically known as goiter. Two conditions that are specific to Graves' disease are Graves' ophthalmopathy and dermopathy. About 30% of people with Graves' disease will exhibit some kind of eye symptoms, and this is known as Graves' ophthalmopathy. Inflammation of muscles and tissues surrounding the eyes, causing symptoms like bulging eyes, gritty sensation in the eyes, pressure and pain in the eyes, puffy and retracted eyelids, reddened or inflamed eyes, doubled vision, and in severe cases, vision loss.
Oh no!
Graves' dermopathy, on the other hand, is the reddening and thickening of the skin, most often on your shins or the tops of your feet, medically known as pretibial myxedema. Other symptoms that are more general and related to hyperthyroidism includes anxiety and irritability, fine tremor of the hands, heat intolerance, weight loss despite normal eating habits, change in menstrual cycles, diarrhea, rapid or irregular heartbeat known as palpitations, and sleep disturbance. How is Graves diagnosed? Your doctor will likely have a clue based on family history or physical examination. To confirm, your doctor will need a couple of blood tests, which includes T4 and T3 levels, antithyroid antibodies, and an ultrasound of your neck to visualize the thyroid glands more accurately. Now, how do doctors treat Graves' disease? There are 3 treatment options available. We usually start with antithyroid drugs such as metimazole or propylthiouracil. We would also co-prescribe beta blockers to help reduce the effects of your symptoms until the antithyroid drugs begin to work. These drugs can be tried up to 1 to 2 years, after which one will usually achieve remission. However, if one still doesn't achieve remission after 2 years, we will recommend radioiodine therapy. It involves the ingestion of radioactive iodine 131, and it is more effective than antithyroid medications. However, the main side effects would be permanent hypothyroidism, and patients may need lifelong replacement of thyroid hormones thereafter. Do note, however, thyroid ophthalmopathy is a contraindication for radioactive iodine. For patients who have a very large and obstructive goiter, surgery is usually recommended. Total thyroidectomy, the total removal of your thyroid gland, is the standard of care, but one will run into the risk of surgery and will also need lifelong replacement of thyroid hormones. So there you have it, guys. This is all you need to know about the Graves' disease. Stay tuned for more thyroid topics like this, and don't forget to hit the like button, share and subscribe for more content like this in the future.